Good afternoon, fellow Rotarians and guests. So we're starting at 12 o'clock on the dot today instead of 12:05 because we've got a lot of stuff going on. Let's see. I'm going to start with some first off, my name's Christina Mean, and I am the current president of this club. I forget that some of you might not know me. Okay, I'm going to start with some announcements. This Thursday, After Hours group is meeting at the local Q. Anybody is welcome to join. That is a great networking environment because they don't really have a particular program and a speaker like we do. So that is an awesome way to network. And July 29th, next Tuesday, we are having our brown bag lunches. Announcements have gone out about that, and I hope that you've signed up. Last year, I got to go to Center Stage, or not last year, but the last time we had a brown bag lunch, went to Center Stage and got a backstage tour. It was great, and got to hear some theater stories that were also fun. And I think next week I am going to Jay Handler's place at Goodwill, and I'm very excited to see that. So if you haven't signed up, please sign up for that. August the 7th is Thursday, and it's going to be at Stir, the new restaurant in Greenville. It's on McBee. I'm very excited to go there because I haven't been there yet. And we have been trying to help a Child's Haven clean up their yard a little bit. We've been out there a couple of times. Amy and I had a fun Sunday morning together, sweating our tushes off. But they're going to be out there cleaning up again on August the 8th. So mark your calendar for that. Is that? No, that's the wrong date. It's August 9th, isn't it? Yes. Okay. August 8th, Alexander Elementary School cookout. Who has participated in that cookout before? Is it fun or what? It is so fun to get out there and cook those teachers some hamburgers. And then we have our meeting next week with Philip Kilgore. Not next week, but August the 12th, in 2 weeks. And okay, today's positive word. Even during your darkest times, know that you are not alone. You've never been alone. You are loved, and you've always been loved. You are needed. You have purpose. You matter. Let's rise for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with liberty and justice for all. Okay. Happy Bucks. Hey, Ryan. Oh my gosh.
Thank you, Prez. Thank you. Hey, everyone. I'm Ryan Thackeray here to do our Happy Bucks. If you have any happy news to share, we would welcome the opportunity for you to tell the club here over the microphone. There is a catch, of course. Once you drop a few bucks in the Alzheimer's research buckets, our cart buckets here. Oh, and Rob's our first contestant. Oh, he's giving me a bucket. All right, I thought it's empty. Does anybody have any happy news to share? All right, Lisa's here. Thank you.
That is also to cover the fact that you are working back in town. And I've had somebody ask when our next hike is, so maybe we can arrange that now.
The Community Foundation hike with the Rotary Club of Greenville will be happening. Stay tuned on your emails. I look forward to leading that. I did cut my hair. I have less credibility out on the trails these days, but I can still help lead a great hike. Thank you, Lisa, for your generous contribution. Any other happy bucks, happy news to share? Hey, our Rotarian of the Year. Holy smokes, and it's an honor.
I'm just very happy to be back from 4 weeks vacation in Germany, and it feels like being back home now. Thank you so much for having me today.
Thank you. Welcome back here stateside, Christina. Other news to share, happy news to share. Oh, there's a big. Holy smokes, birthdays. Well, you normally have one once a year, right? Is that correct? We got a birthday for you, sir.
Gonna say something?
Yes, sir.
Help me stand up.
Yes, sir.
Yeah, it's nice to be back and able to walk on my own, even though I can't get up and down on my own, it looks like. I want to thank all the members that called and wished me well and sent me notes. I really appreciate it. Thank you very much.
Big birthday? How many years? We've got to know. The crowd wants to know how many years.
In Rotary, 73. I've got 70 years without missing a meeting. The first 3 that I got in on Tuesday, and on Wednesday I was at Fort Jackson going through 16 weeks of infantry basic. Didn't get back here for 2 years. And that's the reason that discrepancy between my length of membership and without missing a meeting. I have missed 2 weeks ago, but I plan to make up. Thank you very much.
Yeah, next time y'all miss a meeting for having too many emails to answer your inbox, you remember Bill here, who's always made it a priority here. So happy birthday to you, sir.
This boutonniere is compliments of Jenny. She gave me one last year for the same occasion. Thank you.
Shout out to Jenny, our great club administrator. Happy birthday, Bill. Hope it's a great one for you, sir. Any other happy bucks to share here? Oh, wait, we got a happy bucket. Thank you. Thank you. Hopefully you guys put some money in there while I was hanging out your table. Last but certainly not least, call for any happy bucks. Well, we are happy that everyone is here today. A special welcome to all of our guests, and thank you all for a great Tuesday.
Thank you so much, Ryan. And don't forget, just because you didn't have a happy buck announcement today, that does not mean that you don't pass that bucket around at the table and put in $1, $5, $100, whatever you have in your wallet. So don't forget about that. Okay. Do I have some guests today? Do I have somebody that brought a guest?
My name is Michael Simmons, and I'm with South Carolina State University 1890 Research and Extension.
Awesome. It's great to have you. Any other guests? Introduce your guest and tell us how you know her.
Hi, this is Gretchen Hughes, and she is an intern at Jasmine Road.
Hi.
Okay. Welcome, Gretchen.
And this is Tyler Barefoot. We know each other through the fundraising world. She works for the Greenville Technical School Charter High School. There you go.
Awesome. Thank you. Thank you. Welcome. Christina's got a guest. All right.
I have Holly Dietz next to me. We just met, and because I got assigned to be her host today.
Okay. Oh, awesome. Awesome. Welcome.
And we have our student VJ Madison and his parents joining us today. Yeah.
Awesome. Okay. Amy.
Make people stand up.
Okay.
Hey, y'all. I'm Amy Randall. This is my guest today, Jessica Brock. She is with Table 301. So she said the dinner here is delicious as well. We're super glad to have you here. We'd love to have somebody from Table 301 become a Rotarian.
Awesome. Any other guests? Guests. Any other guests? Okay. Oh,
Hi, I have Gina Blome, who is my Chief Development Officer. She's my guest today. And then I'm married to the speaker, so I'm surrounded.
on that note, do you want to introduce your guests now or later? Okay, he's going to do it later. Okay. So I'll end with the speaker. That's great to have Lesley here. Let's see, what are we doing next on the agenda? I think Dee is up with the scholars.
So, hi, thank you for giving me a chance to do my favorite thing in Rotary, and that is to tell you about the amazing young people in our community. As a co-chair of our scholarship committee, I get the great joy of not only helping to select our scholars, but to get to know these scholars over their time spent in college. And VJ is just really one of the special ones, you guys. We've had a lot of students come through, but, VJ is a remarkable leader. He has maintained the highest academics in one of the toughest majors at Clemson University, physics. And he's already working on graduate level research. He is a leader at a national level in his fraternity and doing just amazing things on campus. And I'm there, so I get to see what's going on. So I really know that he is really making a difference there at Clemson and in the community, still here in the Greenville area. And so with great pleasure, I get to introduce him to speak to you and tell you about his past year of service at Clemson.
Thank you, Dr. Kerry, for that introduction. Good afternoon, everyone. Good afternoon, everyone. Had to make sure y'all were here. All right, so again, like Dr. Kerry said, my name is Victor Madison Jr. It's short for VJ. It's always a pleasure to stand before you all today to give you all an update as to what I've done in this past year. I'll try to stay short on the academic side of things. As she mentioned, I am wrapping up my undergraduate studies in physics. And I have a 3.78 GPA. This will be my last semester doing classes here at Clemson. And my next step is graduate school to study aerospace engineering. I'm aspiring to be an aerospace systems engineer. As a part of that journey, I've been working towards it. I'm actually doing research right now at Clemson, building a ground station satellite system for the university for non-scientific people in there. In short, I'm tracking low Earth orbiting satellites such as CubeSats, NOAA weather satellites, just using ground station hardware and antenna systems. And it's been an enjoyable research experience and a great way to bridge the engineering and physics together in a real world context. Outside the classroom, and if there are any in here, you all understand I was initiated into the Clemson University chapter of Blue Key Honor Society. This is the oldest and most respected fraternity on Clemson's campus. And as members, we don't talk about it that much, but it's definitely an honor to be a part of a group of students who represent scholarship, leadership, service, and character at the highest level on the university's campus. I just finished my term as chapter pole mark of Kappa Alpha Psi for the Kappa Lambda chapter at Clemson, as well as junior province vice pole mark of the Southeastern Province. Now, during my term as pole mark, we applied for chapter of the year on the national and province level, and we won both. So I'm proud to say that I led a chapter to a national award and province award, and it's definitely a highlight of my college career that I won't ever forget. Now, Dr. Kivett said I'm a national leader in my fraternity, and I do have to bring up a little bit of a correction. At the beginning of this month, we had our 87th Grand Chapter meeting in Phoenix, Arizona, and I was there for 8 days, and I was elected to serve as the 66th Junior Grand Vice Pole Mark of Kappa Alpha Psi, and that is the highest undergraduate ranking an undergraduate can receive. So it is a blessing because I never looked to serve in this high of a role when I joined this fraternity in 2023. I just continued to put my best foot forward, continue to serve others as well as I could. And to now say that not only do I represent a fraternity, but all of the undergraduates within the country is definitely an honor, and I'm grateful for it. Service is something that continues to be a central part of what I do. In organizations such as Clemson Hope, we did Christmas gift packaging for students in December. This past semester, on a weekly basis, I helped mentor students at James Brown Elementary, and that is a school for students that speak English as their second language, and that was something really cool. As JVP, I get the honor of hosting a leadership summit every year, and during that summit, we package over 80 book bags with school supplies for students. And most notably, this past December, I had the chance to travel to the Dominican Republic for the very first time, and I got to read to a local group of students, and that was an eye-opening experience for me, and again, something that I'm truly grateful for. So I said I would keep this short. So all in all, again, I'm just excited to continue to build on all of this. Grateful to stand before you all again today. And I look forward to continuing to share more and more as I complete and finish my undergrad journey. So thank you all.
Good afternoon, everyone. My name is Jason Buffy, newer member of the club, but I've mentioned a few times about my daughter, which is Lauren Buffy here. She's a rising senior at JL Mann High School. But Rotary has many different type of youth and community services. And you know, we hear a lot about the year-long exchanges. There's also a program where there's a summer exchange, and our family has participated in that 3 times, including this year. Lauren, about in mid-June, she flew down to Sao Paulo, Brazil, and she stayed with Bella's family. And recently, Bella has returned from Sao Paulo and is staying with us for a month. So we were taking her around, showing her all the things about South Carolina that are great. You know, we've done as many things as we could. I think we're hopefully going to the baseball game either tonight or sometime soon. But really just enjoying cultural exchange. It's a great opportunity for the kids to get to another country, experience a different culture, you know, vice versa. It's a lot less demanding and rigorous as opposed to the year-long exchange. So a summer exchange is a great opportunity for kids that might be interested in the exchange program, but are unwilling to commit to the entire year. So with that, I would like to introduce Bella Salam. She's from Sao Paulo, Brazil. And as I mentioned, she's staying with us and she has a few words for us and would like to introduce herself.
Hello, my name is Isabella, and I'm from the Rotary Club of São Paulo in Brazil. I'm very happy with this opportunity that I've had to participate in the exchange program. A month ago, Lauren arrived at my house, and I hope she's enjoyed getting to know the culture of my country as much as I am enjoying getting to know that of the United States. Thank you so much for having me, and thank you for your attention.
Thank you.
Thank you very much. Where's Amy? Thank you very much. Thank you so much. The Rotary Exchange Program, I think, is phenomenal. We several years ago, we had an exchange student. That's how I got to know Lisa Mangione so well. And she was so much fun. And if there's anybody out there that's interested in that program, it is a great program. So anyway, so new member video. This is Nick Sky. Is it Sky or Skay? Ski. It's those vowels. It's like a mean. It's like a mean. There's too many vowels. So Roger was going to do the new member video, but he is not here today, so I'm doing it for him. So let us welcome Nick Ski.
I'm born and raised in Sumter, South Carolina. Been in Greenville for about 8 years. My wife and I moved here from Michigan, and yeah, we got 2 little boys. Love just spending time with the family, getting outdoors. Love to fish, play tennis. Anytime we can get outdoors, that's what we love to do. So I've been a financial advisor with First Community Bank. I've been in the financial services world for about 10 years and love what I do, and got a great team that I work with, and happy to join the Rotary Club. Yeah, join the Rotary Club. Just I think, like most people, looking to meet other folks and network a little bit, but also looking for more ways to give back. I've always done a lot of volunteer work, mostly with Harvest Hope and Samaritan's Purse, but Rotary Club just offers so many different areas of service and different projects. And just, yeah, really excited to join the club and get more involved with the community. Yeah, my first area of service will most likely be getting involved with the law enforcement appreciation. My father was a police officer for over 30 years in Sumter, and my brothers are police officers as well. So just have so much love and respect and admiration for everybody in law enforcement. So that'll be the first area, and also looking forward to getting involved with the CARP committee as well. That's near and dear to my heart. My grandmother had Alzheimer's, so those will most likely be the first 2 areas.
Thank you. Now it's my turn. I'm Beth Paget. I'm representing Jane Dyer. If Jane were here, she would be in one of her cute holiday outfits to promote Holiday Fair, which is the revamped version of our Greenville Holiday Village. It will be December 4th through 7th at the Greenville Convention Center. And I'm not dressed up like Jane. She and John are celebrating their 40th wedding anniversary. They're somewhere skating on a glacier in Canada or chasing bears or something like that. What I come to you with today is just a sincere request that you personally or your business or the company you work for consider a sponsorship for Holiday Fair. Why is this important? First of all, sponsorships are the biggest line item in our budget for revenue for Holiday Fair. It is very important that we have an outstanding year this year because this is how we fund most of our service projects for Rotary. So what do you get? You get warm, fuzzy feelings because you will be doing a supersized gift to support things such as the work we do at Alexander Elementary School, from helping buy shoes, sometimes the first new shoes ever for our students. You will help do the teacher appreciation boxes. You will help do all that at Alexander that we do through your sponsorship. This is also how we have money for Career Day, for other things such as Teacher of the Year. It is how we as a club fund our service projects through Rotary. So that's important. But there's more than the warm, fuzzy feelings you get from doing a sponsorship. There are very tangible benefits. This year, to simplify things, there are only two real true levels of sponsorships. At $2,500, you get 10 tickets to the event. You get 4 tickets to what is going to be a very nice VIP event. And then you get a whole lot of promotion. This is about you giving, but you also get, especially if you're coming from a business, whether it's small or whether you work for a company, you get a lot of promotion from this. About 15,000 people attend Holiday Fair every year. So your name will be very prominent. Your business's name will be very prominent during those. We have a level starting at $1,000 that goes all the way up to $2,499. And if you can't consider the higher one, please consider this. Again, we're not asking everybody as individuals to give this, but some of you work for very large companies who are very generous in our community, and it is time to ask them to be generous to Rotary and all the good work we do. You also get some very tangible benefits, such as a couple tickets and a couple tickets to the VIP event, and then also a very significant level of promotion during the event, before the event, and after the event. Can't do 1,000? We are accepting donations as what I'm going to call Friends of Holiday Fair. You will be recognized internally in some way through that by making a donation. It can start anywhere. There's no minimum for that, and it goes up to the $999. So actually 3 ways, 3 levels of giving to this. We need you. We need it. We need for Holiday Fair to be a financial success, a fundraising success for our club this year, so we can continue doing all the good work that we do already in the community. Jane will be back, unless she's eaten by a bear. She will be back at some point soon. So see Jane, see me, or you can either make a first contact with Jenny to get our information about how to make a sponsorship. Again, we would like for everybody to participate in some way, either through an ask, and that could be an ask of a business that you frequent quite a bit, and you give a lot to them, and you may want to ask them to consider being a sponsor too. Any questions, Jane, me, or Jenny, and we'll be glad to help you connect your passion for this club and its service work with your ability to support it through a sponsorship for Holiday Fair. Thank you.
Okay, I have the honor of introducing our speaker today. Her name is Lesley Pregenzer. All right, thank you. I've been practicing. Okay, so Lesley serves as the CEO of Favor Upstate, a recovery community organization based here in South Carolina. And drawing from her own long-term recovery, Lesley is committed to making sure that anyone impacted by substance abuse, individuals and families alike, can access free, compassionate, and effective recovery support. Under her leadership, Favor Upstate is breaking down barriers and reimagining how recovery services are delivered. Through strong community partnerships and a deep belief in equity, she's helping to build a system where support is not only available, but accessible to all. Let's please welcome Lesley.
Thank you so much, everybody. Before I begin, shout out to Greenville Rotary. Congratulations on being named Club of the Year. That's a big deal. Congratulations. Thank you so much for having me here today. Like Lisa said, my name is Lesley Pregenzer, and I'm a woman in long-term recovery from substance use disorder. For me, that means I've not put a drink or any type of drug into my system since May 24th of 2010. Thank you. Thank you. Recovery in any amount of time is something to celebrate. My recovery has given me a life that's a whole lot better than it used to be. Today, I'm the wife and mother that my family deserves. I'm a recovery advocate. I used to be. I am a sister, I'm a friend, and I'm a voter. Let's not forget that. Because of my recovery, I do have the distinct pleasure of serving as CEO of Favor Upstate. With me here today is my colleague Mel Aliff, and she and I will be available after this session to answer any questions you might have. I don't think I need to tell the folks in this room that substance use disorder touches every corner of our county. It is showing up in our schools, in our churches, in our courtrooms, family dining rooms. It is here. It is a national epidemic, and it's time we talk about it and keep talking about it. The judgment and stigma associated with substance use disorder, the silence, the fear, the shame has cost us absolutely too much. And I look over here at your four-way test. And if everybody abided to these four simple questions, is it true? Is it fair? Will it build better friendships? And will it be beneficial to all involved? If we all lived by those tenets, stigma would be busted. So I encourage you to ask questions about this disease and how you can be a part of the solution. For every single person who struggles with substance use disorder, there are 5 people who struggle right alongside them. Those are their friends, their family members, their colleagues who watch them struggle and wonder, what can I do to help? That's where Favor comes in. Favor Upstate is a recovery community organization dedicated to supporting individuals in recovery to substance use disorders. Our mission is simple. We exist to give everyone in the Upstate a fighting chance at recovery. We are led and governed by people with lived experience of recovery. We provide services like peer support, advocacy, community partnerships, direct services, and education, often acting as a bridge between the people who struggle and the community services that are available. The truth is, substance use disorder touches nearly every household in our county. Not just our households, but also our workplaces. There are a couple items I'd like to help clarify about what addiction is not. Substance use disorder is not a moral failure. It is a diagnosable medical disorder as listed in the DSM-5. It is not a choice. People don't wake up one day and think, I'm going to choose to suffer. Everyone, and I mean everyone sitting in this room, everybody we pass along the street, everybody is fighting a silent battle that we do not see in them. Why this matters to Greenville. At our last census report, it stated that Greenville County has a population of 533,384. Now, we know that this is growing every day. Our state Alcohol and Drug Commission states that 20% of our friends, families, and colleagues struggle with substance use disorder. That's roughly 1 in 5 adults. So with these 10 tops in the room, that means 2 of each of you sitting at these tables. I'm not suggesting you. Less than 10% of the people who struggle will get help. Why is that? Mostly it's because people are afraid to ask. They don't know who to ask, and they don't know what to ask. It's not because people don't want help, it's because they're afraid of what will come next. They will be judged. They will be written out of their family, dropped from the community. That's not the kind of place we want to be. So I want to talk, since most of you folks in here are business leaders, I want to talk a little bit about how this plays out in the workforce. 70% of people with substance use disorder are gainfully employed. The workplace is often where recovery begins or breaks down. Nationally, employers lose an average of $2,197 per year per affected employee. That's due to emergency visits, chronic health issues related to SUD, and so on. In Greenville, with a $40.6 billion GDP and approximately 290,000 employed residents, even a 1% prevalence translates to 2,920 cases, costing over $6.5 million annually. These healthcare costs are avoidable. Remember I said that 20% of our population struggles? That dollar figure I just gave you represents 1%. National data shows substance use disorder drives $81 billion in lost productivity, absenteeism, turnover, workplace accidents, and workers' comp claims. If Greenville's workforce mirrors the US average, companies here are likely absorbing tens of billions of dollars in similar hidden costs. Statewide, substance use disorder costs, including criminal justice, healthcare treatment, lost productivity, and quality of life adjustments, totaled nearly $1.5 trillion. That's just in South Carolina. Greenville contributes a substantial portion of that, with 11.8% of South Carolina's overdoses in 2022. The county's productivity and human capital losses ripple outward, impacting budgets, our workforce, and so much more. But here's the opportunity. It is not all doom and gloom. When businesses embrace a recovery-friendly mindset, when they reduce stigma and increase support, they increase morale, employee retention, and loyalty. Rotary International acknowledged this by establishing the Rotary Action Group for Addiction Prevention in 2013, which is a multidisciplinary project geared to eradicate addiction and overdose deaths. In short, addressing substance use disorder in the workplace isn't just the right thing to do. It's strategic, economic, and mission critical. Recovery is good for business. At Favor Upstate, we provide free, high-quality recovery support services to individuals and families with no fees, no barriers, and absolutely no judgment. We offer trained and certified peer professionals, people with lived experience, meeting others where they are and walking beside them every step of the way. We focus our work in 3 distinct impact areas: rebuilding lives, healing families, and strengthening communities. At Favor Upstate, close to 12,000 people have attended in-person support groups, and that doesn't account for all of the virtual services we provide. Close to 3,000 family members have found hope and help. We've distributed 11,700 harm reduction tools and logged 425 helpline hours in the Upstate's only substance use disorder crisis helpline. Favor offers real connection, real hope, and real help right now. When a workplace replaces fear with support, this results in loyalty, resilience, and a healthier team. Checking my time here. At FAVOR, which stands for Faces and Voices of Recovery, like I said, our mission is simple. We exist to provide everyone in the Upstate a fighting chance at recovery, and that includes our workforce and our employees. Our goals are clear and deeply transformative. We want to help more people in Greenville County find their way back to family, purpose, and stability. First, we're expanding our outreach into rural areas of the county, because no one should be denied help due to distance, lack of transportation, or limited local support. Secondly, we're building out our capacity to support medically supported recovery options. Many of you know someone, maybe in your church, your civic group, maybe even your family, who has struggled to get off of opioids or alcohol. These tools, especially when paired with faith and peer support, help people stay and stabilize in recovery. Third, we're partnering with local employers to create safe, accountable, recovery-friendly workplaces. We're not asking businesses to lower their standards. We're helping them support employees who want to meet them. This disease isn't just about headlines or heated debates, which we hear all the time. Who's at fault? Or believing it only affects marginalized individuals. It shows up in quiet ways. What we believe, how we talk about addiction, who we trust. As we already established for employers, it shows up in good employees leaving instead of asking for help. It shows up with missed work and productivity, with rising healthcare costs and safety concerns. So here I'm here to share about what Rotary can do to help with this epidemic. We invite you to become a recovery-friendly employer. We'll help you get there. Host a lunch and learn at your place of business to begin opening the topic. We'll help you. Contact the Rotary Action Group for addiction prevention. We'll help you. Rotary Action Group for Addiction and Prevention supports local Rotary clubs to make an impact, save lives, and eradicate addiction. Support this mission financially or through volunteerism. We can help. Let us create a community and a corporate environment where recovery is celebrated, not swept under the rug. Embracing and celebrating recovery from substance use disorder is a powerful healing force that benefits everyone. I leave you with this. The face of substance use disorder isn't always easy to recognize. It doesn't care about your age, your gender, your economic status. Substance use disorder is killing our friends. It's killing our colleagues. And I hope not, but some of you in this room may know that it is killing our family members. We have an opportunity to change this trajectory. And by you sitting in these chairs today, I'm considering you some of the enlightened ones who are choosing to make the decision to be part of the solution. Changing hearts and minds requires a sustained and continued commitment from all of us. Let Greenville be a city where people get the support they need, not the shame. Let's build a workforce, a community, and a Rotary that says, we see you. We believe in you. And I promise you, you do not walk this journey alone. So I think I ended early. We're here to offer answers to your questions. We also, Mel, did we bring some Narcan? Okay, we also provide free Narcan through a grant by the state of South Carolina. We have Narcan distributed at all of our centers. We have 5 centers in the Upstate. The one in Greenville is on Woodruff Road. How many in this room have, first of all, heard about Narcan? Nice. How many of you have seen Narcan? Nice. Anybody ever used Narcan? Nice. I'm sorry you had to do that, but I'm glad that you were equipped. What is your name? Gretchen. If we could all be like Gretchen, we don't have to use it, but we should be equipped with the knowledge and the tools to be able to save a life. So this is Narcan. It looks like just your regular basic nasal spray. When you, if, and I don't imagine many of you will, but if you come across someone who you wonder, is this person passed out? Is this person sleeping? But you're kind of worried about them. This is how you can tell if someone is in an active overdose. You can walk up to them, shake them on the shoulder and say, hey, are you okay? And if they don't respond, the first thing I always recommend is to call 911, because I am not a medical provider. I'm a concerned community citizen, and I will make sure that people get help, but I'm not a medical professional. So I'm going to call 911. And then I'm going to say, hey, are you okay? The easiest way to tell if someone is in active overdose, it does not matter skin tone, the lips will turn blue. So if you are equipped with Narcan, each box comes with 2 packets. Take it out of the box, put it up a person's nose, and depress the plunger. It is as simple as that. The person's overdose will be reversed, and they will come back to life as if nothing ever happened. And that is precisely why we want 911 to be on their way. So I encourage you, now that you are part of the enlightened ones, to take this with you. I don't want you to use it. I do want you to have it. I've known plenty of parents who have taken it, brought it home, given it to their children, people in their communities. Look, I don't want this to be the case, but I do want you to be prepared. And I want you to educate your children on the fact that this is a disease and it is preventable. I'll get off my high horse now. Does anybody have any questions? Yes, sir.
Dave, help a couple in their 70s who has a daughter in their 40s who's an addict. She's been in and out of recovery, lost her job, has no health insurance, has no benefits, spiraling downward. So is that something you could help with, or is there another organization that we could steer them towards? Because you keep on mentioning recovery, and I keep on thinking people in the recovery process that are doing well. But what about the addict in crisis right now?
Oh, thank you. Well, people don't find recovery unless they're first addicted. So yes, we absolutely will help your neighbor. Not only will we help your neighbor's daughter, but we'll also help your neighbor understand what the disease is. We offer a robust family program. Families all across the upstate don't understand how to deal with this disease. Speaking from experience, my daughter became mentally stable when she was 21. How many times did I stand in front of her and go, would you just stop? Okay, this is coming from somebody who lives a life in recovery. So we work with the parents and the family members and those who love those who are struggling to understand their part in the disease. So yes, of course, we can help your person who is in active addiction. One of the ways we do that is we have peers stationed in our upstate emergency departments. For someone who comes in with an active overdose, the physician on staff will tap us on the shoulder and they'll say, hey, can you go see this person? And the power of someone who has been there and understood the real challenges that this person is going through, sitting down and talking with them one-on-one, it's unlike any other experience. We've been there, we've done that, we get it. We have the ability to talk with your daughter's friends. We have a helpline number. It's included in the information we brought. That's 864-430-1802. Open 7 days a week. Other questions? Yes, Ryan.
No paperwork on the initial
Yes.
Interesting. I would all appreciate less paperwork, but also obviously very intentional with why you all. I'm just curious if you could speak to that as well.
Yeah, thanks. Thanks for the question. So one of the challenges that people who are seeking healthcare services of any kind face is going through a litany of paperwork. We just decided to bypass all of that and go straight to, how can I help? What's going on? Let's talk about it. We don't care who you are. We don't care who you come from or what you're struggling with. We're simply here to be of service. So we have no fees, no barriers, no judgment. We are able to do this thanks to the generosity of Greenville community members, through corporate foundations, through churches, the state and county government. We are a recipient of the South Carolina Opioid Relief Fund, and we're able to garner all of these different resources together to provide these services to individuals. Thank you for asking that. Yeah. Spot on. We start the conversation, and your friends who are struggling watching their colleague suffer, we can work with them as well to understand what is this disease? How do you talk to someone who's struggling? We also want to create cultural work environments where it's okay to talk about things. It's okay to talk about struggles. Right now, we are transitioning from, we have an opportunity to change our cultures into a place that is much more supportive of the whole person, not just the person who shows up at work from 8 to 5 every day, because we know that that's just a very small piece of who a person is, right? So we work with the corporate culture. We're also engaged with corporate EAPs to be a resource to them. The first thing we want to do is just encourage a conversation, because by giving people a safe space to talk about challenging things, it's a difficult thing to do, and it's a really rewarding thing for employers. Was there one over here? Yeah. All opiates. All opiates. Fentanyl, if it's an opiate, it doesn't, if someone, what's your name? Jim. If Jim had one too many cocktails, it would not impact his buzz. If somebody took one too many hits and were overdosing, it would immediately reverse it. So it's the difference of the drugs. Any opiate, it will immediately reverse. You had a question?
I don't have a question. What I do have is a family that's been incredibly impacted, not only from substance abuse, but from favor. And more than anything else, what I have is thanks. Because I can tell you right now, as somebody, my ex-wife, not only is active recovery, but worked for favor for years and ended up getting her bachelor's and eventually her master's in social work because of the help that she got through favor. My sons have had issues with substance abuse disorder and have been welcomed and helped in incredible ways through favor. And I can say that today we are, as a family, getting continuing support with an active addict in our family right now. And they are not just, favor is not just wrapping him up. They're wrapping all of us up and realizing that the entire family is in need of that kind of support, even though the family has gone through this many, many, many times and knows a lot of what we're working on. But it's different when it's inside. It's different when it's your own family, and you can know everything and still not be able to make that dent. And so, you know, from somebody who has seen what favor does and what you represent and the way that you do it, I know you personally haven't been there, you know, super long, but the organization has, and they've been there for me They've been there for my family. And I just want to say thank you because the stigma is real. And I never in a million years would have said this out loud in this meeting until today. So thank you.
Oh, I appreciate you very much. Thank you for your courage today. That took a lot for you. I'm very proud of you, and I'm very proud of your family for continuing to come back. Thank you.
Thank you so much. Thank you. Thank you. Yeah, I thought it was a good time, a good point to end on with those comments by Jay. I too have a son that had an opioid problem back in high school, and he went through Favor, and he's doing pretty well. Well, he's off the drugs anyway. So, yeah. So thank you for that. We did have Lesley. I had her sign not one, but actually 2 books. They're both the same that we will donate to Alexander Elementary, and I'll give them to whoever's going. Mike is going. So I wanted to reiterate just a couple of things. One, VJ, amazing, just an awesome, awesome student. And Beth was talking about holiday fair. It is so important that it is all hands on deck with this fundraiser because that money supports that student. And maybe not him specifically because he's about to graduate, but students that are going to come after him. And I don't know if anybody is aware, but we've actually had to lower the amount of money that we're giving in scholarships because we don't have enough money. So this fundraiser this year, Holiday Fair, is extremely, extremely important. I also wanted to note that we do have our Unite for Good banner for the year. I forgot it last meeting, but now it's here. So, and with that, I think we'll stand for the 5-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? And will it be fun?